Uh,
Yeah.
Thank you again for agreeing to sit down and to talk about your experiences, both as an
Hmm.
advocate and as a cancer survivor, and also about vulvar cancer awareness, which we are
Okay.
right in the middle of Vulvar Cancer Awareness Month for on our social media. We have been promoting the idea of self-examinations for vulvar
Hmm.
cancer, which I think is extremely important, as your
Hmm.
story is going to tell us. So, if, for anyone who is watching this, Sonia Rademaker is a patient advocate in Belgium and very active. She's been a member of ENGAGE and a delegate of Esperanza in Belgium to the ENGAGE Patient Advocacy Seminar many times. So, Sonia, could you please tell us something about yourself?
About myself. I live in a small town, a small village, in fact, near Brussels, not far from Brussels, and near the airport in Flanders, in Belgium. Flanders is in Belgium. And I'm retired, as you can see, perhaps. I'm retired. And I'm working a lot for Esperanza because I'm organizing a lot of events and gatherings. Also, already 100 events we organized till now. Yeah,
Mhm.
and also symposia. I'm busy now with our ninth symposium in the academic hospitals with the specialists, and it's
Wow.
always workshops. And we start with workshops,
Mhm.
agreeable workshops, because I want to make something agreeable of it also, not only boring lectures. And afterwards, we invite the specialist at the table, and we do conversation tables per pathology.
Mhm.
You know, all the pathologies, cervical cancer, uterine cancer, ovarian cancer, vulva cancer, and vaginal cancer.
So it's
Uh,
an opportunity for people to get one-on-one question
yeah,
time with some of these professionals,
at
right?
the table, so they can talk to
Wonderful.
the specialist and they can talk together.
Mhm.
Because our main goal with Esperanza is to create a connection between the
Mhm.
fellow patients. It's our main goal. Uh,
Wonderful.
yeah.
So Sonia, you started your patient advocacy journey because you are a patient, right? Could you
Yeah.
tell us about your experience with vulvar cancer?
Yes. Unfortunately, I was a vulvar cancer survivor, fortunately and unfortunately. But my personal story starts 11 years ago. No, no, starts when I was 15 years old. But I will start with more recently, 11 years ago, when I underwent this radical vulvectomy. And what is a radical vulvectomy? The inner and outer labia are removed. In my case, the clitoris also was removed, and also in my case, 30 lymph nodes in the groins in both legs. So that was a rather heavy operation.
Of course.
And my story, in fact, starts when I was 15 years old, so a very long time ago, uh, with LS. LS is lichen sclerosis, and it's a chronic skin disease, a genital skin disease, so on the vulva. And it's characterized by white spots, eh? A parchment-like skin, very thin skin, a lot of itching, horrible itching, in
Mhm.
fact. It's not possible to describe because it's really terrible, and pain. And yes, what can and infections. I had a lot of
Mhm.
infections also. So during my whole life, I had lichen sclerosis. Uh,
And did you know what lichen sclerosis was at the beginning?
no, not at all. I
No.
was only 15 years old, and it was not
Mhm.
known at that moment.
Mhm.
I speak of 50 years ago, so you
Uh-huh.
can imagine. But I found a dermatologist, fortunately, that knew what it was. And so he was very nice and he explained it to me and so on. But when I was 18 years old, I went to a gynecologist
Mhm.
and he scared really the hell out of me because
Oh,
he was telling about an operation that he just performed on a vulvar cancer patient. And he described all the details and the blood and the mutilation, etc. I was 18 years old. So I left his office really completely shocked. And he told me, yes, it's possible that you can also get vulvar cancer from this lichen
wow.
sclerosis. So my whole life through, I was really anxious about
Sure.
getting vulvar cancer. And when I was 60 years old, buff, I got the diagnosis vulvar cancer. So this was also a tsunami for me, a
Hmm.
shock. I awaited it a bit, but well, it was still it was a real shock. So I had this radical vulvectomy then, mm, and I was 13 days in the hospital. I stayed 13 days in the hospital. Afterwards, I went home. After 2 weeks, I was again in the hospital with via the emergencies because I contracted this erysipelas, and
Uh-huh.
erysipelas can happen with this operation. It's my right thigh that was terribly swollen,
Oh,
nearly purple, and a big infection.
oh my.
So during 1 week. I received a massive doses of antibiotics at the
Hmm.
hospital, and then I could go home because I was very afraid of getting lymphedema,
Hmm.
these thick legs. I was very afraid of that, but it went all right. So during 5 years afterwards, uh, I was at ease. I was relieved because they eradicated the whole of the lichen sclerosis. And so I didn't have any itching anymore, any pain anymore. And in fact, I had a big operation, but I was happy
Sure.
between in brackets. And the problem is that it's an autoimmune
Hmm.
disease, lichen sclerosis. And after 5 years, it came back. And it came back, in fact, in full force. And so now I'm so 6 years later, and I've still lichen sclerosis and really afraid of a relapse
Wow.
because,
And
yeah,
can I ask for our people who might be watching this interview, you had lichen sclerosis all of your adult life. What was the symptom that made you finally go seek a diagnosis of vulvar cancer? Uh, was that just
yes,
through a routine examination, or was there something that
yeah.
caught your eye?
I didn't know that then, but in fact, you should do regular checkings of the vulva. I didn't
Uh-huh.
know it, but I went to a dermatologist, and in fact, when you when you have lichen sclerosis, you have to go both to the dermatologist and a gynecologist. I
Both
did it,
specialties, huh?
yeah. I didn't know that so much at the time, and since this doctor scared the hell out of me, I went more to a dermatologist than to a gynecologist. But in the end, yes, I went to a gynecologist because I had a small lump, a hard lump,
Hmm.
and that is no,
Hmm.
characterizing, how do
Yeah,
you say it?
characterized.
For vulvar cancer also,
Uh-huh.
but also yeah, bleeding, pain, a kind of wart, like I just told you about,
Hmm.
and a wound that doesn't heal, that are all characteristics of that can be a vulvar cancer.
Hmm.
So uh, I went to the gynecologist, and he saw it
Uh-huh.
directly that it was vulvar cancer. And I was going already, I think, allez, 1 year to a dermatologist, and she didn't
Hmm.
see it. And I
Uh-huh.
told her I had a lump, but she saw it, but she treated me with antibiotics all the time, but it
I
didn't
see.
help. And then
Hmm.
I went to the gynecologist.
So
But
I
I,
think that's a really good point that just one doctor, if it's a little bit outside their specialty, might not see the full picture, right? So patients need
yeah,
to understand
yeah.
that you need both opinions. And also about self-checking. Was that something that was recommended to you at the time? It doesn't sound like it.
No, not at all. No, not at all. It's something new. It's a new evolution. And yes, there are other evolutions at this moment nowadays because the operations nowadays are less extensive. I
Uh-huh.
had a radical vulvectomy, but now they want to preserve the issues more and more. And that's good. The stay in the hospital is shorter, and they want to preserve more the clitoris, the
Mhm.
anus, the urethra, and that's a good evolution. But if it's necessary, it's necessary, yeah.
Of course.
But there's
But
another,
in general, it means that the patient's recovery and quality of life
yeah,
afterward are less impacted now
yeah,
than before. Is
yes,
that right?
yes. And there is also a new evolution, the sentinel node
Uh-huh.
procedure.
Can you
So
explain a little bit if someone's
yes,
watching and they don't know?
it also evolved. So normally they can operate on the first sentinel and
Hmm.
not the rest of the lymph nodes. And 11 years ago, it already existed, but it was not so refined.
Uh-huh.
So in fact, they removed 30 lymph nodes in
Okay.
my groins, but in fact, it was not so necessary because I didn't have metastasis, you
Uh-huh.
see. And now they take care of this much more. And I think that doing that way, that you get less lymphedema also, because less lymph nodes are removed. So in general, I think there's less chance, I think so, that there is also uh, lymphedema developing from this vulvar cancer. So that's a good
That's,
evolution.
yeah, wonderful
Yeah.
progress.
Yeah. So that are the main, and also expertise centers.
Yes,
Uh,
tell us about that.
Nowadays, there is, yes, they are called vulva poly or vulvar clinics,
Hmm.
and you go to a specialist, to specialists.
Uh-huh.
And now the new evolution is also, I know that, for instance, in UZ Louvain, you can go to a consultation together with the dermatologist and a gynecologist. So that
Uh-huh.
is also a new evolution, which is very good.
Right, this multidisciplinary approach to bring together all of the
Yeah.
expertise.
And I recommend really when you have vulva cancer to go to an expertise center, to an
Mhm.
academic hospital, because it's not so, it's a rare cancer, but they are more used to operate on this and they have more knowledge about that. And
Right.
also I recommend to find a nice, and a gentle surgeon, a nice oncologist, uh, because it can be a very stigmatizing condition, not always, but it
Mhm.
can be a stigmatizing condition. So uh, let you help by gentle persons if it's possible.
And is that something in Belgium right now? Do you feel like there is a stigma toward vulvar cancer or gynecological cancers?
Yes, we do a lot to make it known,
Mhm.
to create awareness around it and so on, because 80% of the, no more, I think, don't know that it exists. When you start to talk about that, oh, is that possible? I never heard about that, and so on. So it's really necessary also to give a voice to the patients, to the vulvar cancer patients, to give them a stage to to explain what they went through and what it is, etc. To be careful of this lichen sclerosis. And we have a member of Esperanza, Veronique, she's
Mhm.
called. Um, and she already made several videos
Yes,
around
you can watch
LS.
that on our Instagram. Yeah.
And she talked to several newspapers already, to several magazines. She also appeared in a book
Okay.
on cancer and sexuality. And she appeared on television, also with her husband, which was really unique because I don't think that's ever happened already.
No, for sure. And I mean, that's something gynecological cancers affect not only the patient, but their whole family.
Yeah,
And
yeah.
I think that's something people don't
So
understand, right?
yeah, we want to give also voice to the partners. So when we do gatherings and events, we also invite the partners, a friend, sometimes a daughter, sometimes a mother, and
Mhm.
they can all come. So just one person, but not the whole family. But that gives a good feeling
Mhm.
for these patients. And then these persons also think we are also important. We are not just sitting on a sideline and watching what happens, but we are also important and we have also a voice. We can also talk about it. And that's very important. Yeah.
And that also, I imagine, impacts the patient's quality of life too, to know that they don't have to be quiet and that they're also that their partner or their loved one has taken some interest
Yeah.
in understanding what they're going through, right?
Because now we are organizing also, and we have a table, a special table only for the partners.
Hmm.
Yeah. guided by oncopsychologists so
Hmm.
that they are able to talk about it. And also a testimonial, because it's with different testimonials of all the different kind of cancers. Also a testimonial by a partner, because
Okay.
we think it's really important.
Can
Yeah.
you tell me something about the oncopsychologist? I think that that might be a career that people aren't aware of, that or a
Yeah,
position within the medical.
it helped me a lot, this
Uh-huh,
to go to an oncopsychologist and to an oncosexologist
uh-huh,
also. And oncosexologists often are also psychologists.
mhm,
So then you have both together. And going to this oncosexologist helped me a lot. Also with my husband, I went to my
mhm,
husband, and it was a real relief because she tells you what you can do
mhm,
for your sexual intercourse, or is it if it's not possible anymore, also
mhm.
that you don't have to get a trauma of it.
Yeah.
So it's good for both in both cases, because in some cases intercourse is not possible anymore
Mhm.
because of the operation and
Right. I mean, and there are, I think, people who are afraid also to talk about that with their partner.
yeah,
So
that's
having
true.
this, it makes it a doorway for them
Yeah,
to be able to discuss some things that maybe
yeah,
they
yeah, yeah,
would
yeah.
keep inside, right?
Yeah, yeah. So I asked her, this oncologist, sexual oncologist, I
Mhm,
asked her to make a booklet, a
uh-huh,
brochure. And she made a brochure, Sexuality and Intimacy for Gynecological Patients, for the 5 pathologies. And I let it translate into English. I
mhm.
sent it to ENGAGE. They put it on the website,
Yeah,
and now it's already translated into several other languages,
yeah.
European languages. So
That's a great addition to the brochure section on the Engage website. If anyone's watching this and they haven't looked at the Engage brochures, I encourage you to do so. We also have
yeah.
some fact sheets about vulvar cancer there. And now,
I
oh,
tr-
go ahead.
sorry. I just translated the whole brochure on vulvar cancer. And I also let it print in 2000 what do you say it, copies,
Uh-huh.
and I sent it to a whole lot of hospitals.
Oh,
So
wonderful.
they put it in the waiting rooms and so on. So we
So some
do a lot.
physical copies that people can
Yeah.
look at too. Nice.
So we do a lot for awareness also in that way, and also with campaigns. Huh?
Right, right. So
Yeah.
speaking of campaigns, right
Yeah.
now, on our social media, you have helped us to create the Vulvar Cancer Awareness campaign, where we're talking about uh, don't forget to check your vulva. And it's as you said, when you were diagnosed, it wasn't a recommendation, but now the recommendation is that every few months, I'd say once a season, people can take a mirror and do a quick self-check to look for signs of vulvar cancer. That
Yeah.
is such an amazing tool to be able to check. And it's funny how people are afraid to talk about that when breast cancer, people have, I think, been routinely self-checking for signs of breast cancer for decades now. But now we have a
It's a
new.
very intimate zone, but
Sure.
it's difficult because it's a very intimate zone.
Right.
But it's also important, I think, these campaigns because of the aging of the population.
Mhm.
So this LS, normally you get it at the menopause
Mhm.
when you're 50 years old, or yes, and it can evolve to vulvar cancer when you are 60 years old, 70
Uh-huh.
years old. And so it's important because the population is aging, there is more chance. And I must say, uh, I think there are more cases in general than what
Uh-huh.
is told about, yes. Uh, because since I started with Esperanza, I already saw a lot of
Mhm.
women with LS or with vulvar cancer, more than I was aware of. And
Really?
also uh, younger women can
Mhm.
be affected because of this HPV virus.
Yes.
So it's also important because it's sexually transmitted, it's also important for younger women. And I know that the rate is increasing with
Right.
younger women also.
Right.
So
And even though most cancers are falling, vulvar cancer and I believe endometrial cancer are rising.
yeah. So, but normally 80%, let's say 70, 80% of vulvar cancer is caused by LS, by lichen sclerosis, and then the rest, it's a smaller amount. But I think now it's also increasing. This
Mhm.
is really related to vulvar cancer.
Right. So
So
everyone should know that it's a
yeah,
possibility first,
yeah,
and
yeah, yeah,
secondly, that they can do some checks for it.
yeah.
Sonia, thank you so much for joining us today. Is there any final thought? If somebody has recently been diagnosed or they're facing perhaps going to the doctor to ask about a diagnosis, is there
Mm.
any word of advice or comfort you would like to give them?
A word of comfort, something positive,
Mhm.
because we are always talking about stigmas and stigmatizing condition, etc. But you can also consider it as one of the cancers among the other cancers. You can also
Right.
see it like that. And Veronique is also telling this all the time, and then it's a positive way of thinking. And also the fact my gynecologist told me, Sonia, remember or think about it, it's only 2% of your whole body that is
Oh,
affected. And
right.
yes, sometimes I think about that. It's simple, but it helped me also a lot. Yeah, in general, yes. I wanted to say something I don't know anymore. Oh, no, I don't know anymore. A moment, please.
No problem.
Yes, that you have to go on enjoying your life. You
Yeah.
have to distract yourself, relax, try to relax, not focus all the time on this vulvar cancer or on
Mhm.
this condition, but try to enjoy again, even with vulvar cancer.
That's wonderful. Thank you
Yeah.
again, Sonia, for all of the work that you do and for taking the time today. Our